Yeah, my name is Miles Tamarasan. I'm a chief resident this year. I'm from Lincoln, Nebraska.
Hi, my name is Jill Haxel. I'm a current 5th year at the program, and I am from Springfield, Illinois.
My name is Cam Wagner, and I'm a 4th year surgical resident at Iowa Methodist, and I'm from Central Iowa.
Hi, I'm Rebecca Gibbon. I'm a 3rd year resident here at Iowa Methodist. I'm originally from a small town in Eastern Oregon.
My name is Kaylee Doctor. I'm a 2nd year resident at Iowa Methodist Medical Center, and I'm from North Dakota.
Hey guys, I'm Nayland John. I'm an intern at Iowa Methodist Medical Center. I'm from Illinois.
Hi, I'm Jessica Caruth. I am an intern in the surgery residency program at Iowa Methodist Medical Center. I'm from Minnesota originally, and I went to medical school at North Dakota. So coming here, I think there's a shift in general just when you change from a medical student to a resident. But one thing I think that Iowa Methodist does a wonderful job of is really making you feel like you're part of a team as soon as you get here. You're now seen as a colleague and a peer among not only your residents that you're working with, but your attendings, and they treat you like that as well. There's a really great culture of respect, and you're expected to pull your own weight, but there's also this team backing you that can help you, and they're very understanding as an intern that you're gonna have questions, lots of questions, and they are there to back you up and answer those and get you through everything.
We are so supported, whether it be from the attendings we work with, the staff of the residency, and even the people around the hospital.
All of our staff are extremely approachable. If you ever have a problem, whether it be professional, personal, just need someone to talk to about really anything, they're there for you, and they're easy to get a hold of, and they really value our opinions as surgeons in training. They're from our trauma staff to our general surgeons to our colorectal surgeons. They all take a lot of pride in educating residents and medical students, and they really enjoy what they do, which makes our job learning as a surgical resident a lot easier.
I look around at my co-residents, the staff, and I know they would do anything for me. They're approachable. I remember the first day getting all of their cell phone numbers, where if we had any trouble, we could contact them, and I'm speaking for the residents and the attendings as well.
The relationship with the staff is really wonderful, and they make working in the OR so fun. They are really great at giving us a lot of autonomy and graded responsibility, so you never feel so uncomfortable or unsafe.
Our staff are all tremendous to work with. They're very nice, and they're also very patient, which is very important for our training. You know, I'm going to be graduating after this year, and I'm really going to miss them. You know, I wish I could come back after I graduate and work with them just so I could, you know, learn more from them, and it's certainly a big strength of our program.
They are very good at getting you in and doing things right away, especially when you're on call or if you're on smaller teams like a 2-person team or a night team. You're getting in there right away. You're scrubbing cases where you're first assist with an attending, and you're getting hands-on, not just holding retractors, but actually doing parts of the procedures. You might be doing art lines or central lines, and really getting actual hands-on experience and really getting to know how to do these things and care for your patients.
I've loved it here so far. It's been great. My first 2 months have been on trauma rotation. In that rotation, I've gotten great support from my attending physicians, as well as been able to be super involved. Even as an intern, I got the opportunity twice to be at the head of bed during level 1 traumas, which is not very common at a lot of programs. So you get a lot of autonomy and a lot of opportunity to really partake in your patient's care.
I remember my first day being in the OR and being guided through a gallbladder and coming out and learning how to do orders, and then going later that week to conference. And so really right away you start off getting this graduated autonomy.
We get lots of traumas coming in. We work with the trauma staff who are really wonderful. They're very active in our education. We get to take care of really sick ICU patients, and it's nice learning how to take care of the sickest patients in the hospital. We do a lot of procedures at the bedside, and as we become proficient at them, we teach our interns how to do them as well.
Even in the ICU, I've gotten the opportunity to do a lot of really cool procedures, whether it's putting in a chest tube, arterial lines, central lines. my chief lets me do those myself. So it's been really cool to just be able to take that next step as you start intern year and really get to partake in those procedures.
Another really important part of being a resident here at Iowa Methodist is that it's a teaching program. And so the faculty are teaching us as residents, but as residents, we're also teaching medical students. So we have third-year medical students that come through, as well as fourth-year medical students doing their sub-internships. And so as interns, we really get a hands-on feel with teaching them, especially since we're the shortest removed from that process. And so I've been really passionate about that, and I try to be very conscious of the fact that I was just there and I know kind of how they're feeling, and it can be very nervous. You can be very nervous to be a medical student at a program like this and like coming into any program, but I do my best to sort of help them learn techniques and get some hands-on skills and really make sure that they're getting involved and being able to answer questions and learning while they're here.
We do lots of bedside procedures, and as you become more proficient at those, you start teaching the interns how to do bedside procedures. We get to run traumas, so here in the trauma bay, we run lots of traumas. Our trauma attendings are really wonderful to work with.
We get exposed to a lot of different surgical procedures, and we get a good volume of all those procedures as well. For example, we rotate on the general surgery service a lot. We do a lot of vascular work, we do endoscopic procedures. We also get great experience in independence at other rotations. We work at the VA hospital here in town, and there's also Broadlands that we work at, and we get, like I said, a lot of independence out there, and it really kind of preps you for being your own practicing physician.
Another reason is autonomy. I feel absolutely comfortable going straight into general surgery practice, and I couldn't feel more prepared coming out of this residency.
So I feel very prepared for our upcoming mock orals and boards. One of the things that I like is every Tuesday we do a resident-only board prep. And so this year we go through a book, it's Savastin's, so we're doing that, and then our SCORE curriculum as well. That time is great, so it's a protected time for us where we go through questions and just have good discussion about cases. The reason why I mention that is because we are prepared to go out into general surgery practice. I am looking at going into broad spectrum general surgery in a rural area, and I feel very prepared from this program to do that. We are prepared, like I said, from day one, and we are prepared for boards from our studying, from our conference time, from the questions in the OR, and from our surgical training as well.
We're very fortunate. We get experience at a variety of sites here in the Des Moines area. We have our home base in downtown Des Moines at Iowa Methodist, but we also spend 3 months our second year at the Veterans Hospital, which is just a little bit north, as well as 3 months our third year at the Broadlands County Hospital. Those rotations give us a lot of great experience in terms of bread and butter general surgery procedures, and it's also part of our graduated autonomy. At those sites, you are the primary operating surgeon, you run your own clinic, and you get to help book cases for patients. So it's great as you move along in residency to build your skills and see a different type of patient. So you get the good classic appendicitis and hernias, and then when you come back downtown, you get to do the more complex tertiary referrals.
One of the other amazing things about this residency program is the lack of fellows. So we don't have any competition when it comes to getting into the OR. We get in as soon as we start residency, and we have progressive autonomy as the years go on. As a chief, especially at the community hospital and even here at the main hospital, I'm the one leading the cases with the junior residents, so I feel incredibly prepared before I go out into practice.
Des Moines is a great city to live in. One of the things that I like the best is the food culture, and so the residents, all of us, when we're not in the OR, we're usually finding a place to eat. There's a lot to do, a lot of hiking around here as well, so it's a great place.
A couple weeks ago we went and floated down a river, which was nice, a nice way to spend the day off.
Even for a Midwest town in the middle of Iowa, Des Moines is a wonderful place to live. I currently live downtown in an apartment, and there's endless things to do with a bunch of the other residents. Could be riding a bicycle around to different breweries, exploring the art museum, various restaurants, and of course sports activities. But overall, we never lack things to do and really enjoy the area.
Being in the city of Des Moines has been amazing. There are so many things to do here. The cost of living is amazingly cheap. You're able to afford a lot of house, you're able to have fun on the weekends. There's a lot of different trails to go biking on, hiking on. I'm an avid pickleball player. There's tons of courts to be able to play on. Even though I bring down the average age by like 15 years, it's still a good time. And also our program is super collegial. So we have done a lot of different activities outside of the hospital, including going to an Iowa Cubs game with a lot of the different staff. We also have gotten to go to a couple of the breweries with some of our attendings and just enjoy having a relationship outside the hospital.